And welcome everyone to the Healing Connections podcast. This is Emmy Vadnais. I'm your host, and today we are talking about how healing works with Dr. Wayne Jonas, who is a practicing family physician and expert in integrative health and healthcare delivery, and the author of How Healing Works. Dr. Jonas is currently the Executive Director of Samueli Integrative Health Programs, an effort supported by Henry and Susan Samueli to empower patients and doctors by providing solutions that enhance health, prevent disease, and relieve chronic pain. Additionally, Dr. Jonas is a retired Lieutenant Colonel in the Medical Corps of the United States Army. He has served in the roles of Director of the Office of Alternative Medicine at the National Institutes of Health, Director of the World Health Organization Center for Traditional Medicine, and is the President and Chief Executive Officer of Samueli Institute, a nonprofit medical research organization supporting the scientific investigation of healing processes in the areas of stress, pain, and resilience. He is also a professor of family medicine at Georgetown University and you're going to have to help me, Dr. Jonas.
Uniformed Services University.
Thank you. Welcome, Dr. Jonas.
The nation's military medical school.
Fabulous. So, Dr. Jonas, you have quite a background, and I just want to first thank you so much for all that you've contributed. You are truly, I would say, a national treasure for all of us. I recently read your fabulous new book, How Healing Works, which we're going to be talking a lot about here today. And you really had a unique experience with, at the beginning of the book, you share about how I believe you were living in Vietnam.
Right.
And that seemed to perhaps open you to maybe another way of looking at healing that maybe a lot of physicians in our country or mainstream healthcare don't see. Is that true?
That's true. I was actually a kid in Vietnam. I was 9 and 10 years old. And my father was stationed there, and families were allowed to be there at that time before the war escalated. One of my best friends was a Vietnamese boy, and we were in the Boy Scouts together. And I saw how he, when his grandmother got sick and was treated in the traditional hospital, I saw how she was treated. I saw how he was treated when he hurt his ankle. And then I got sick a couple times and went over to the military medical center, and it was very, very different. And everybody said, gee, we've got a great system and we're healing people and that type of thing. So immediately, before I even thought I was going to be a physician, I realized that there were very different cultural approaches to health and well-being. And so that sort of stuck in the back of my mind, wondering, how could all these systems that are so different, both in wording and conception and science, et cetera, all claim to be working? What might be the underlying mechanisms of healing? Might there be some underlying mechanisms of healing that we could investigate, do good science in, and begin to understand that would enhance healing for everybody? And that's really what opened my eyes to this area when I was a kid. And then as a professional, I was myself in the military and stationed in Germany. I got trained in standard conventional medicine. I got trained in standard high quality science, double-blind, randomized control, placebo-controlled trials, and bought into all of that. Still believe science is a core aspect of how we need to approach healing. But I began to apply those tools to things that I learned in Germany, for example, in which they were using herbs, acupuncture, homeopathy, that type of thing in the conventional medical field. And so that tweaked my curiosity even more. And I began to look at it through a practitioner's eyes and then ultimately a researcher's eyes to look at healing traditions from around the world, trying to understand how that happened. And I'll have to say that it was largely my patients, in addition to the research, that really showed me how it works in day-to-day practice.
Yeah, you do a really beautiful job in the book of sharing these stories, and you weave it in and out as you share the science behind it, and also how we have our own hidden power to heal that we'll talk about in just a moment as well. So you have done a lot of research. How did you become the former director of the Office of Alternative Medicine, which is now the National Center for Complementary and Integrative Health?
Well, as many things in life, it was a matter of being in the right place at the right time and a bit of luck. I was running the Medical Research Fellowship, which is a research training program at Walter Reed Army Institute of Research at the time, had been doing that for a number of years, where I taught research and research methods. The Office of Alternative Medicine opened up, and they were looking for a new director. And because of the background I just described, my experiences in Germany and in Vietnam and other places, I said, gee, this would be interesting. There isn't enough data. There isn't enough research in these areas. Wouldn't it be fun to go over and do that? So I applied for the job. I was accepted, and I ended up being detailed over there. I didn't want to leave the military at the time. I liked what I was doing in the military. I liked teaching research at Walter Reed and other places. And so I asked them, why don't you send me over there for a period of 3 years, which is a typical assignment. So they agreed to that, and I went over there and I ran the office and built it into, or helped it become a center. That was at the time called the Center for Complementary and Alternative Medicine, NCAM. And then when that was done, I went back to my day job over at the military and the military medical school until I finished my government career.
Mm-hmm. And what do you feel you're maybe most proud of, or what did you see happen in your time and in that position of the director of the Office of Alternative Medicine?
Well, it was an exciting time because when it first started, it opened up the dialogue and the conversation to the plurality of methods that exist around the world, not only of healing methods, but a plurality of philosophies and a variety of ways of understanding what it means to be a human being and how does healing actually happen, from Ayurvedic medicine to traditional Chinese medicine to Western developed practices like chiropractic and osteopathy and Reiki, and that's not what Western, but homeopathy is an example of that, and herbal medicines. And so it was a very exciting time. There was really a lot of pent-up energy around that. The public was using these practices very extensively. Surveys had shown that 30 to 40% of the public regularly use some kind of non-mainstream practice they didn't get from their doctor, or they didn't get in the healthcare system. They were paying for it out of pocket. They wanted it. It was providing something that they needed, and yet the medical profession and the research environments were not even looking at it. And so it was a very exciting time to help release that pent-up energy, if you will. And, when I and others saw that this was not a flash in the pan, this was actually a long-term effort from traditions that had been lost largely or ignored or unknown in the West, but had been going on in many cases for millennia outside of Western medicine, that there needed to be a long-term effort to do this. And the only way you do that at the NIH is that you have your own center or institute that has its own budget support year to year to year. An office doesn't have that. So the most important accomplishment was to create the center, because that then set up a durable effort in which the government was specifically investing in research in those areas. So after all the excitement, we got the center going, and it settled down to the routine work of day-to-day research.
Well, thank you so much for helping create that. It continues, and I'm very grateful for that. It's a great website for those who are watching or listening to definitely check that out. And there's data that continues to show an increase of the public's use around this. And this is something that I hope we can address a little bit more, is that it seems that a lot of people are interested in these whole person approaches, integrative health, holistic medicine, whatever the various terms are. And yes, it is seeping into mainstream healthcare, but it seems that there's still a disconnect that hopefully we can continue to bridge. So let me ask you this. How come you decided to go ahead and write this amazing book? In fact, I really hope, and I really hope this becomes a textbook in medical schools and other health schools, how healing works. What was the impetus for this?
Well, I wrote the book hoping that a lot of providers and the public would read it, obviously, and that if it became a mainstream read for medical schools, I think that'd be fabulous. I wrote it because there is a major misunderstanding about how healing works. People nowadays, especially in the West, have suffer this illusion, really, this myth that healing comes from something that your doctor or your healthcare provider does to you. You go in, you take a pill, you get stuck with a knife or a needle, and even if that pill's an herb or something like this, that somehow that produces the healing. And while those things are very helpful in helping to induce healing sometimes, the data shows that that actually produces very little of the actual health and well-being that we run around with. In fact, the data has shown that it's only about 15 to 20% of the public's health and your individual health come from the pills and procedures, whether it's in an unconventional practitioner's office or a conventional practitioner's office, to produce this healing. The other 80% comes from you. And it comes from an inner capacity to heal that is facilitated and stimulated by activities that you do outside of your healthcare visits. There are multiple things that do that, but there are a set of core activities that then tap into and induce that healing process. And if you can activate those, if you can engage in those and activate those, then you will tap into the other 80% that the medical profession is just leaving on the table and is not there. And so you'll get the majority, the vast majority of health and well-being from those things, provided you actually engage in the kinds of behaviors, perspectives, understanding that produce those. So I wanted to describe how I learned that from both my own practice and patients that I had seen that hadn't gotten better from the pills and procedures I was providing, and then got better when they tapped into their own inherent healing capacity. And also from the research that I'd done around the world, showing that there was a common set of processes in all healthcare systems, ancient, modern, and modern, that tapped into those same components. So I wanted to help dispel some of those myths, and at the same time, provide the public and providers with tools for getting at that in a rapid and effective way. And so at the beginning of the book, I describe how I discovered it. In the middle of the book, I show the different components that allow you to activate that healing capacity and the extensive research that's now around showing actually how that works. We actually have a lot of research on the different components. And then at the end of the book, I give tools both to providers and to patients to show them that how do they actually do this now every day in their practice and in their lives.
It is a very comprehensive read. I feel like I need to read it about at least 2 or 3 more times to really fully integrate it. It really resonated with me as a healthcare practitioner and as a person in general about many of the things that you share in there. And one of the components that seems to really stand out is what a lot of times gets dismissed as the placebo effect. And how do you feel that mainstream healthcare can begin to optimize what is commonly referred to or dismissed as the placebo effect, which I think you're saying is the same as this 80% of this ability for people to tap into their own healing? Is that correct?
Well, research on the placebo effect allows us to begin to understand many, not all, but many of the core components of how healing happens. Placebo has got this sort of dual face in modern medicine. On the one hand, it's used to describe something inert, a sugar pill, for example, and therefore, by definition, doesn't work. And on the other hand, it's used to describe for that large part of healing that occurs when you do a drug study, and you find that the majority of people are getting better on the placebo, something that we know doesn't work. And so on the other hand, on one hand, placebo is defined as something you want to get rid of, right?
Right. It's confusing. I mean, it can be confusing, so I appreciate you explaining it to all of us.
And on the other hand, it's something you want to enhance, actually. And so a number of years ago, Dan Mormon from the University of Michigan and I wrote an article in the Annals of Internal Medicine called Deconstructing the Placebo Effect and Finding the Meaning Response. And so the meaning response is really what you're trying to uncover to optimize in any kind of therapeutic system that you're trying to do. And placebo research on the mechanisms of placebo, allow us to see the science behind that, behind the meaning response. And so things like belief, conditioning, social learning components, and expectation are all elements that facilitate and enhance healing when we go through the ritual of care. And that produces a huge amount of the effect, especially in chronic illnesses, especially in illnesses, diseases where there's both a subjective and an objective component of it. And so understanding that is what I wrote about. I was enlightened about this when I did my first randomized double-blind placebo-controlled study with a vitamin to see if it worked for osteoarthritis called niacinamide. And we set up the study. I enrolled people. I and the patients were all blind as to who was getting the placebo, the sugar pill, and who was getting the active, purported active vitamin niacinamide. And I had a patient who was enrolled in the study, and she got remarkably better. Older woman with severe arthritis, her energy improved, her depression improved, her mobility improved, her pain decreased. She went back to her volunteer job at the hospital, which she loved. She began to move more, and I thought, eureka, I found the cure for arthritis, until I broke the code and I found out she was on placebo. And then I realized she had tapped somehow into her inherent healing capacity, and I needed to figure out what that was. And so that launched it was early in my career, and that launched me on this journey to understand what are those underlying elements. I think that if we acknowledged those components that we now call placebo, instead of saying, let's try to get rid of them, we would be able to enhance any approach and optimize healing no matter what. I call it the sleeping elephant or the sleeping giant within medical research. As soon as it wakes up, it's going to change our entire perspective about how healing works.
Well, thank you so much for you being investigative, truly, and being a true scientist and a person of heart. You know, how is this possible? This person healed when they were on, quote, the placebo, and in your book really shares a lot about that meaning and how important it is for practitioners to work together with the people they're serving to find out. And you talk about that in your hope protocol and so forth. What do you feel, Dr. Jonas, would help did you call it the sleeping elephant to wake up, or what do you think needs to happen for, is it people like you and I having these discussions and just it continues to kind of catch? Is it medical schools having fabulous books like this in there? Like, what do you feel needs to happen for more people to really tap into what you describe as 80% of our own healing can come from within ourselves?
Well, I think people, first of all, have to understand what research is already there. There's a tremendous amount of research showing that the physical environment that you live in impacts your health and well-being. We all know that lifestyle and behavior have a huge impact on maintaining health and even reversing disease. Nutrition, diet, sleep, stress management make up probably 60 to 70, if not more, of the underlying chronic diseases, and can actually be used to reverse illnesses. The social environment is a huge component. People that are lonely are much higher risk for developing diseases and dying early than those who are embedded in a good social environment. And I tell many stories about patients of mine who have utilized their social environment to get through and heal themselves. The spiritual and mental environment is key. This is at the heart of meaning. if you can attach why you're here in life, what's most important to you, to your own behavior, to your social environment, to the physical environment, and to your medical treatments, you're going to get a lot more impact and unleash that component. And if you go through rituals that do that, like we talked about in the placebo effect. Let me give you an example. I had a patient of mine, an older man. He'd had chronic back pain. You're an occupational therapist, right? You probably see a lot of people with chronic back pain. It's a huge problem in the country, the #1 chronic pain problem in the country. And we're currently going through an opioid and chronic pain crisis because people with chronic pain, like this particular fellow, are often put on opioids, which we know not only eventually don't help the pain, they actually cause other problems like addiction and tolerance. So he had been through the gamut. He'd done lots of conventional treatments. He'd done lots of alternative treatments for his back pain. He'd been on and off opioids. He'd had surgeries and injections and electrical devices and manipulation. And he was pretty discouraged. And he came in, and I do what I call a hope visit, a healing-oriented practices and environments visit. And this is really an integrative health visit. It is beyond integrative medicine. It's about how do you bring self-care into the medical encounter and bring in evidence-based complementary practices into that. Now, he'd done most of these things. And I start the hope visit off with a question about what matters to a person in their life. Not just what's the matter. He'd already had that question asked many times to him, what's the matter and how can I fix it? But I asked him what matters to him. If he had health, if he was free of his back pain, what would be the most important thing that he would do? And he immediately knew. He immediately answered me. He said, Dr. Jonas, he said, the thing that is of most value to me in my life now is playing with my grandkids. They live 5 hours from here. I cannot get into my car and drive 5 hours down and then get on the floor to play with them. And that breaks my heart. That's the most important thing in my life. So guess what I did? I simply took him, I picked him up, I brought him to an occupational therapist, physical therapist like you, and I said, I want you to help this person get up and down off the floor. He said, absolutely. She began to work with him on that, to get up and down the floor, work on those core muscles, etc. It hurt, okay? It was not getting rid of his pain at the beginning. He was muscling through that pain, but he was so motivated to do it that he worked for 3 to 4 weeks just to do that. And after that period of time, he was able to get up on down the floor. And he called me about 2 months later, and he said, Dr. Jonas, I just got in the car. I drove down the 5 hours, and I got on the floor to play with my grandkids. Thank you so much. You know what? He never stopped doing that. He he got in charge of his own self-care. He began to do those kinds of exercises and self-care and other things on his own. And in about 6 to 9 months, his pain was markedly diminished and his function was markedly improved. That's the meaning response. That's hooking to the mental and the spiritual component and then bringing in the behavioral component that taps in to our own inherent healing capacity.
What a wonderful story. And yeah, that's an example of, rather than treating what's wrong with somebody or how can we fix you, which, no, people don't like to think that they're broken, and then really tapping into that light and that joy and that meaning for that individual so that they can be intrinsically motivated and rise above what might be limiting them. I know we just have a few minutes left. I just want to check in with you about one of the things that happened to me early on in my career as an occupational therapist, and one of the reasons why I had some hard times working in mainstream healthcare, is that, there are stats that 70 to 75% of chronic conditions can be prevented through lifestyle changes. Why do you feel, or what do you think needs to happen for our healthcare system to move from a disease sick care model to more of a preventative model? I know when I was in OT school, I already had known I wanted to work in preventative care, but when I got out, I sadly learned it wasn't reimbursable.
Yeah. Well, I think the main thing is that our system needs to understand the science that underlies healing and acknowledge that the evidence that exists for how healing happens, and I try to put that in my book. And we need to redesign our systems so that it does that. We're already, I hear so often from providers who want to do this, mainstream providers who want to do this, they say, I don't have time to do it. I didn't have the training necessarily to do it. And I can't get it paid for. Those are the kind of the main challenges that they throw up. And I say, well, when it comes to time, you're already spending a lot more time than this requires if you look at it over the entire life of a patient, for example, like the man I just described. And if you're going to do it in 20-minute chunks and all you're doing is things that you can just get reimbursed for by pills and procedure, then that's going to cost a lot and you'll never be able to do it. So you need to reorganize how you deliver it. The time is there. I'm often said, well, I can't get it reimbursed because they only will reimburse me for this. And that's a challenge. There's no question about it. Our system pays for volume rather than value and outcomes. But it wants to change. You hear value-based healthcare now. That's often a mantra. We haven't quite got there yet. So we're still trying to fit a round peg into a square hole. So you need to be creative about it. But there are ways to actually code and get reimbursed for this kinds of care. On my website, I put a whole set of tools of how to do an integrative health visit. And it shows how to do a personalized health inventory, how to do a hope visit, how to follow up on that, and to create group visits and health coaching and utilize people like occupational therapists and others to make that happen. And then there's a coding component. How do you code for this? And if you're creative about it, and you don't have to cheat, you just use what's there, you can actually do this in a way to get the cost covered. And so I don't accept those excuses anymore. Time and reimbursement. I say, if you want to do it, you can do it. If you go to my website, drwaynejonas.com, we are putting tools out there that are free for how you can begin to do this now in your practice. You don't have to get certified as a holistic practitioner, although if you want to, you should. You'll learn more about it and have more tools available. But you can begin to do this within your practice today if you want to.
Wonderful. I know for myself, I'm in the Twin Cities here in Minnesota, and so I wasn't able to be in network with some of the major insurance companies because it was already so saturated with OTs. And I was discouraged at the time, but what I discovered is that I developed a cash-based practice, and I was able to have more freedom and how to work with my clients who come in to see me, and I'm not as beholden to insurance companies. But it's nice to hear that there are ways, and definitely check out Dr. Jonas's website. Do you feel that are you a fan? I feel like a universal healthcare system might be helpful. Do you think that's something is that something you feel would be beneficial or not necessary?
Well, clearly every civilized country in the world has, almost all civilized countries in the world, and those that can afford it and even some that can't afford it, have recognized that health is essential for the flourishing of their people, for the economy to function, for democracy to reign, et cetera. And so most countries in the world have adopted universal health care. I think that tells you something. U.S. is not, but it certainly tells you that universal health care is a key, important human right that needs to be available for everyone. But if we simply suddenly waved a magic wand and suddenly everybody had platinum level health care in this country, the data shows that it actually would only improve health about 15 to 20%. And so it would not be a solution to our healthcare crises. It depends on what we do in that system. And what we do in that system has to have a strong element of primary care. It has to reach outside of the office and outside of the hospital and deal with the preventable causes of illness and do those proactively. It needs to deal with risk factors in those areas. It needs to support the ability for behavior change. It needs to bring in less expensive approaches to things like chronic pain, for example, than we currently have. And so if we were to change to this kind of an approach, which I call an integrative health approach, if we had a healthcare system that covered integrative primary care, for example, I think we would not only enhance the health of our country, we would reduce costs, we would improve satisfaction, satisfaction. We create a flourishing society, which is, I think, the ultimate goal of what healthcare says they're trying to do.
Yeah, yeah. Well, thank you for all of your efforts in that regard. We need to wrap up. Is there anything else that you would like to share we haven't yet addressed, or anything you would like the listeners to know about how healing works?
Yeah, I think the main issue is that you don't have to wait for universal health care to come. You don't have to wait for value-based care to come, although push for those, no question about it. Push for those, advocate for those, lobby for those. But you can change the system right now. You can change it by beginning to do integrative health in your own practice right now and adapt that to the environment that you're in. For those of you that work in areas where there's a lot of social disparities, there is a tool on my website that talks about how to do an integrative health visit with social disparities in the context of social disparities and social determinants, and how to do that. And there are more and more tools that will continue to populate on the website that show you actually how to do that. For example, food deserts. Simply providing people in food deserts with the ability to eat helps improve and manage diabetes instead of just prescribing medications. 2 weeks ago, another large study came out and showed you could reverse diabetes. You could prevent the advance of diabetes in those who have pre-diabetes by lifestyle. And so begin to ask those questions to your patients in your practice. There's a simple set of questions in the Hope Note and in the Personalized Health Inventory that you can ask tomorrow to the next patient that walks through your office. So let's do it. Start now.
Wonderful. Thank you so much, Dr. Wayne Jonas. And we appreciate all that you're doing. And I know you have there's more we could have discussed, but definitely, can people go to your website? Is there a newsletter that they could join so they could get updates from you on what's happening or how to get more involved to move healthcare in this direction?
Yes. I put out a lot of stuff on social media. I have a Twitter account, I have Facebook account, LinkedIn account, and I put things out almost every day on that. And then I have a monthly newsletter that summarizes some of the latest activities, some of the new tools that we've developed. And if anybody out there has good tools for doing this, that they find work within their environment, we're always interested in shining a light on those, making them available, disseminating them. So contact me at healing@drwaynejonas.com, and we'll contact you back. We'll look at those and help to disseminate how healing works around the country and around the world.
Fabulous. Well, thank you so much for your time. Do get a copy of How Healing Works. Get well and stay well using your hidden power to heal. You will not be disappointed. It completely resonates with me, and I think it will resonate with all of you. Do visit Dr. Wayne Jonas at drwaynejonas.com and visit us at holisticot.org. This is Emmy Vadnais. Thank you so much for joining, and we'll see you next time. Bye for now.
Thank you, Emmy.
My pleasure.